In this brief PowerPoint presentation, I would like to guide students who are seeking ADA academic accommodations at Heritage University know how to apply for these support services. Hi, my name is Giovanna Cook and I am the Mental and Social Health Counselor ADA Specialist. In this first PowerPoint slide, you're able to find all my contact information. Please watch the rest of the presentation to become aware of the procedures and guidelines that a student seeking ADA accommodations need to meet in order to be eligible for these services. The Office of Ability Services for Student Affairs at Heritage University operates under the Americans with Disability Act of 1990. This is also known as the ADA law. Under this law, we want to protect our students and make sure that they are not discriminated against based upon their physical, mental, or any other type of disability they may present. Disabilities fall under a very wide spectrum, but in this PowerPoint slide, I am mentioning the ones that are very well researched and well known. Cognitive and developmental disabilities like Asperger's disease, autism, mild retardation, and any other type of impairment that may be left because of brain trauma. Learning disabilities like dyslexia and dyscalculia, physical impairments. Mental health disorders fall under hidden disabilities, and these may include things like depression, anxiety, post-traumatic stress disorder, and any other type of mental disorder that falls under the DSM-5. Chronic or acute illnesses. We recognize that students may be facing health problems, and we still want to make sure that they're honored with accommodations. Some of chronic disease can be related to asthma, diabetes, chronic kidney disease, HIV, cancer, and the list is really big. But we want to make sure students voice out their concerns regarding their health issues. Heritage University is willing to tailor academic accommodations based on our students' needs. It is important that you voice out your concerns and what works best for you. In this slide, I am providing a list of the accommodations that are mostly requested by students in higher education. Extra test taking time, a quiet room for test taking, flexibility on assignment deadlines, flexibility on attendance, visual support in the classroom, preferential seating in the classroom, audio recording class lectures, lecture note support, and audio test books, among others. Heritage University also offers temporary accommodations, and this is available to any student attending our institution, not just those students with permanent disabilities. These include things like maternity leave, compassionate leave to attend a family funeral, and medical leave to attend important health issues and medical treatments. It is important for students to know what are the specific requirements that will make them eligible to receive academic accommodations at Heritage University. Remember, we operate under the ADA law, and therefore we must meet federal guidelines. Students must provide a description of the limitations and functional impact of their disabilities. This information is usually gathered over the phone, via email, a Zoom meeting, or a FaceTime conversation. A student must also present medical health records with a formal diagnosis stating a health issue or records of treatments that they've received in the past or they are currently receiving. Students may also bring records of receiving ADA services in previous institutions. This can include things like an individualized education plan, also known as an IEP. Please visit our webpage to find further information and become aware about the ADA guidelines and procedures to be eligible for ADA services. Counseling services is also available at Heritage University. Due to the pandemic, we are offering new strategies for students to be able to access these support services. You can reach out via Zoom, a regular phone call, via email, or a FaceTime phone call. When to seek counseling services? When students are dealing with things like symptoms of anxiety, symptoms of depression, family conflict at home, severe stress, time management, and other type of issues that are hindering your education. Anything that is affecting your academic performance and your general education. Within my scope of practice as a clinical social worker, I've received the appropriate trainings and several years of practice to offer the following approaches: cognitive behavioral therapy, dialectical behavioral therapy, or just simply talk therapy. My hope is to help students develop the appropriate coping skills that can help them navigate in their difficult circumstances and personal struggles. Students are often hesitant to share information about their health and their personal struggles. Your information is confidential. At the Office of Ability Services, we want to make sure you feel as safe as possible. My office is regulated under the Health Insurance Portability and Accountability Act, also known as HIPAA, and the Family Education Rights and Privacy Act, also known as FERPA. Your medical records and your medical diagnosis are protected and confidential. However, it is very important for students to know that confidentiality can be broken at any time when a student reports things like homicide or suicide plans. We want to make sure that our students are safe and that our campus is safe. Students are also required to sign a release of information known as the ROI to disclose information within other departments in our institution or outside agencies.